You're listening to the best of the Dental Up Podcast 2019 with your host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here, and welcome to another episode of the Dental Up Podcast. Today we are showcasing some of the most unique stories and interviews of 2019. But before we begin, the team and I would like to thank you for listening, subscribing, and most importantly, downloading the podcast. We're about to hit 200 episodes mid-February, and we couldn't have done it without you. Some of the guests that we are showcasing today are Dr. Toorani, Dr. Taddey, Dr. Bowman, and Dr. Lau, just to name a few. Before we begin, remember to subscribe, leave a review, and share with your fellow dentists or friends. Now, without further delay, let's begin.
This is the Dental Up Podcast.
Currently practicing from La Jolla, California, please welcome Dr. Tracy Taddey, DDS. How's it going, Dr. Taddey?
Hi, Brandon. I'm great. How are you?
Oh, doing good, thank you. Now, this is
Good.
it's been great conversing with you over the years here, and it's kind of interesting because I've never asked you this question, but why did you get into dentistry? At what point did you think that you wanted to become a dentist?
Well, my story's a little bit different probably than most dentists. I was at NYU as a journalism major, and I thought I really wanted to get into magazines and fashion and beauty. So I pursued that career, and I worked at Elle during college as an intern, and then I was hired as a health and beauty editor when I graduated. And I just wasn't really happy doing what I was doing. It just wasn't very satisfying. The work environment wasn't very enjoyable either. So I really liked the health aspect of what I was working on with articles and things. So my dad suggested that maybe I'd want to be a dentist. And I said to him, "Are you crazy?" I hadn't really been a science major or anything, but I really thought, wow, I could combine the health and beauty of what I'm doing in journalism and maybe transfer that into, dentistry with cosmetic dentistry. And I always wanted to work with my dad. So I just decided to go for it. And so I left Elle and I took all the science classes I needed, the prerequisites to apply for dental school. And then I wound up getting into UOP in San Francisco and just loved it and really happy with my career change. So it's been 21 years now, and I'm really happy I decided to just go for it.
That's excellent. Like you mentioned about your father being a dentist, was he pretty much your main mentor in dentistry?
Yeah, really, because I hadn't really been interested in it before. So he was my main mentor in the beginning. And then I actually came up to your lab where I met you guys and took the over-the-shoulder program with Dr. David Hornbrook. And that's where I really learned all my cosmetic skills, and then started working with your lab and really started doing some really bigger, greater cases. And so that was my next mentor after my dad. Besides mentors I had in school, I really liked my dental school, so I learned a lot, and the spirit and just the whole environment there really, I think, added a lot to the way I practiced dentistry.
This is the Dental Up Podcast.
Currently practicing from Huntington Beach, California, please welcome Dr. Brian Toorani, DDS. How's it going, Dr. Toorani?
I'm doing great, thanks. Thanks for having me.
Yeah, it's wonderful to have you on the show. I appreciate you taking time out of your schedule to meet up with us. Thank you.
Oh, my pleasure. Love doing this stuff and love giving back to dentistry in any way possible.
All right. Now, along these technologies where we've become so digital, the art of one-on-one conversation seems to have been lost for the most part. Is there any tips you can give on how to communicate with your patients?
Yes, you're absolutely right. It's funny. One of the things, like we just signed up for Dental Intel. I'm not sure if you guys are familiar with that, but basically it's a company that takes data out of your practice management software and makes it easy to understand what you need to do, what you need to work on, how your practice is doing. Basically, it foolproofs or simplifies your metrics for your practice. And one of the things I started doing was I started calling my patients that I hadn't seen myself. Mm-hmm. And when you call patients yourself, they hear your voice. It's got such an amazing effect. Patients take it more seriously. They really appreciate it. So that's one of the things. My advice would be, don't as awesome as digital is, nothing can replace your passion and your your love for your patients. So make sure you share that with them. Let them know that you love them, you care for them, and you want nothing but the best for them. And sometimes that just means you got to get on the call yourself, or, just send a handwritten card coming directly from you, the dentist. And it has such an amazing effect on patients. So in a way, sometimes it's kind of nice to be old school and pick up that call instead of sending a text.
Yeah.
Just as I mentioned to you before this podcast, I was in a quick meeting and I was tempted to send an email, but I said, let me just talk to my employee and find out what's going on. And, when I just sat down and talked to her, I realized a lot. I got a lot more information. There's something about when you see someone, you hear their voice, you see their face when you're talking to them, that no text or no email or no FaceTime can ever replicate.
Yeah, there's no
so
tone.
don't lose sight of that. Yeah,
Mhm.
Stay in touch with the humanistic side and let your patients know you love them.
Yeah, that's excellent. Are there any other tips that you could give about establishing the positive, strong culture in your practice?
Yes, the hardest thing for me, Brandon, has
Mhm.
been to become a better listener. And I'm not saying just hearing things. A true listener. And a listener isn't just listening with your ears. You're listening with your eyes. You're listening with what you hear, but also with what you see.
Yeah.
And truly listening to your patients, truly listening to your team members, and being there fully is so magical and so powerful. And as soon as they know you care for them, you want nothing but the best for them, they will go out of their way every time for you, and including patients too.
Mm-hmm.
So my biggest pearl, number 2, would be on this: to become the best listener you possibly can be. Because by listening, you show that you care. And that is something that has to be real. It has to be sincere. And it'll help you with every relationship in the world, whether it's at home with your wife or partner or husband, or with employees and with patients. Listen to them. And I mean, really listen to them. And that's the pearl right there.
Excellent. Yeah, I most certainly have to agree with every word of that. Now, kind of going along those lines of me picking on you here for some more advice, is there anything that you would be, any tips that you'd be giving dentists coming into the field for the first time?
Oh gosh, yes, lots of pearls for new dentists coming in. Number one thing is, I actually jotted a couple of things, and one of the things I wrote down was know where you are, but more importantly, know where you want to go. See, most of us get all stuck in the commotions and the flow. Oh, my friend's doing this; he's an associate, so I should be doing this. Or, oh, hey, this office is doing it this way; I should be doing it that way. Don't worry about others. What do you want to do? What do you want to achieve? How do you want to work? What's important to you? So that's your goals, that where you want to go. That's your destination, right?
Mm-hmm.
So you have to know where you want to go. And then you have to have a real talk with yourself on where you are. And from where you are to where you want to go, the rest is easy. We get so hung up on these little, courses and tricks and systems and this and that. But more importantly, we are not clear on our own destination. And even if we are, we are not realistic with where we are now. So my advice to the new dentist would be: know where you want to go, know how you want to do things, know what you love doing, and know where you are, and then figure out the space in between. That's your journey. The journey is the fun, easy part. But a lot of us don't actually make a solid plan on where we want to be and by when. We get so hung up on the how, but we need to have an actual vision and a plan of the final destination on what that means to you. And that's my big pearl to new grads is, just figure out what it is that you want to do with your life, what it is that you want to do with your career, your degree, your business, your clinically even, mm-hmm. which procedures you enjoy doing, and master them. Be the best at it, and expand your horizon, learn more new things. But that's one. And then my only other pearl: don't do what I did, which is go crazy and start buying things left and right. Live within your means, save money, and pay off your debt. Pay off your debt. And by the way, pay off your debt. Last year, finally paid off my student loans. Actually, it wasn't last year. It was 2 years ago, December. And it was the best feeling on earth that I finally had a zero student debt balance. And I've been at it since, forever. I had been paying towards that forever. And it felt so great to pay it off. And now I'm on to paying off other debt myself. But that's been the biggest advice I've gotten, and it's made all the difference. But don't get into debt, especially what I call avoidable debt or unnecessary debt. And just live within your means and run it lean and mean and become the best you can be in every task and every procedure that you enjoy doing.
This is the Dental Up Podcast.
Currently practicing from San Diego, California, please welcome Dr. Sam J. Halabo, DMD. How's it going, Dr. Halabo?
It's going great. Glad to be here with you guys today.
Excellent. We really appreciate it as well. Thank you so much. I know that you're a busy man, so let's go ahead and jump right into it. Why did you get into dentistry, and at what point did you think, I want to become a dentist?
So when I was younger, I hadn't been to a dentist. My family hadn't taken me. And then when the first time they took me, it was because I had a big toothache. So I went to the dentist, in complete fear. And then the dentist took my pain away. And this guy became our family dentist. And actually, he became my mentor eventually. So right at that point, I was looking at him going, wow, this could be a pretty interesting career. This could be something pretty cool. And as I grew up, I wound up actually going to his office, volunteering there in high school as well as in college, because I liked the idea of dentistry and just the way he worked. He made his own hours. He would always talk to me about how he got to use his hands, he got to use his mind, and he was very personable, which I kind of love. I'm a dental speaker now as well as having my own dental practice. So I get to speak with a lot of people, and he was always teaching and talking. So I really, I felt very comfortable with that and thought this could be a great career. And the more I researched it and looked into it when I was in college, I was like, I think this is exactly what I want to do. So I eventually started volunteering at some different offices to see what exactly I wanted to do and really see if I was going to fall in love with it. And I did.
That's interesting that you mentioned about the fear of the dentistry and all that, or the fear of the dentist, I should say. And then I was seeing also that you had worked with dental phobic patients at the VA, or I guess you got to apply that even further. Is that right?
Yeah, no, absolutely. So there was parts in our dental school where we actually had to work with patients in psychiatric hospitals, and that was one thing I learned right away was people who were really fearful. And then at the VA was again working with fearful patients. So that's something that's really carried on quite a bit in my career. It was also interesting, I didn't mention, when I was that young, I hadn't even spoken English yet. I didn't speak English till I was 10 years old.
Really?
So I was really terrified of the dentist. Had no idea what he was saying, what he was doing, or anything to me, which eventually becomes a career, and I become a public speaker as well later. So it's funny how life changes at times.
No doubt. And those experiences, now you get to help out others through it. That's really awesome, Doctor.
Yeah, absolutely.
Out of curiosity, because I see, that you've been voted the top dentist in Chula Vista for 15 years. How do you market yourself to your community?
Marketing in our community has been very interesting. Where my practice is, I'll tell you a little bit about my practice and how I kind of came back to here. I moved back to California. I went and did a 1-year residency at Loma Linda Veterans Hospital and passed my California boards and immediately started looking for offices. Once my brother one time called me and he said, hey, my periodontist just called. There's an office here. The guy was running. It's in the South Bay, but he had a mild stroke and he's looking for somebody to help cover for him. I said, well, sure. That sounds like a thing I could look into. And I had built up a number of free days at the VA because I worked all the time and I never took a day off. So I was able to go down there, and every free day I had, I would go and work and try to see how the practice was. This was a smaller practice. It was only 2.5 days a week. You only had like a day and a half of hygiene. But I thought it was kind of ideal to start, and I thought it had a lot of potential. Yeah. And this is 22 years later now. I'm in the same practice, but a much more different dynamic. We're 4 full days here, 4 days of hygiene. I have an associate on Thursdays. We have 4 or 5 people here. So to say that we've grown the practice would be an understatement. We've pretty much, it's gone through a number of renovations in terms of physically and in terms of how many patients have gone through and how many we have now. It's more than quadrupled. So it's been building little by little, and marketing was definitely a big piece of it. When I started, we used to do a lot more mailers and things like that. Now it's become a lot more online with, I have a group that I work with where they do a lot of our marketing now, where I used to be able to do it a little bit more when I had more time, but now it's become something where I actually have a marketing advertising company that does most of it for us. A lot of what they do is more things like through the website, SEO, keywords with Google, some mailers still every now and then, maybe not as much as we used to. But, our practice has stayed the dynamic of it has stayed similar in that it's maintained the private practice feel the whole time, which I really love and enjoy because that's the way I like practicing.
Yeah.
And we like to really individualize the experience for our patients and make them feel really unique. I'm in a very tough environment here where just on my block alone, there is 6 other general dentists and 3 specialists within about 100 yards of me.
Wow.
So we have to really, do some unique things and make the patient experience much more different in order to make ourselves stand out. So that's something that we really pride ourselves on and really work on a lot in order to individualize the experience for the patient and make ourselves unique so that we're sought after and not just a commodity, which a lot of practices are.
This is the Dental Up Podcast.
Currently practicing from New York, New York, please welcome Dr. Lauren Becker, DDS PC. How's it going, Dr. Becker?
It's going great. It's Friday, gearing up for the weekend. How's it going with you?
Oh, same. Definitely excited for the weekend.
I hear that.
Now, in your website, you mentioned biomimetic dentistry. What inspired you to go on this route?
So, ironically, the first practice that I was working in, the person that I was working for said, "I'm going to this conference, or I'm taking this course. It's a holistic type of dentistry," and I was like, "Okay." And he's like, "And you have to take it." And it was $3,000, and I was like, very much like maybe 1 or 2 years out of residency, we're spending $3,000 on continuing education seemed like the most bananas thing I'd ever done in my entire life. And I live in an apartment that's, well beyond what people pay for an entire year. So I even still with spending way too much money to do everything, I was like, I'm not spending $3,000 to take a course. Biomimetic dentistry, if you're familiar or not, is a very conservative approach to dentistry that allows us to only take out the affected caries tooth, but also preserve what's left. So instead of putting a crown on a tooth where you're missing 3/4 of a tooth, we can successfully bond either an onlay or an inlay or even just a composite restoration conservatively and protect the healthy tooth structure that's left. It also helps prevent root canals because the literature proves with 40-year-old literature that there are zones that you can, if you have 3 millimeters of clean peripheral tooth structure, that you can deactivate the matrix metalloproteases in the bacteria and keep them where they are so that they can't travel down to the pulp any further. And so you're doing a major service for patients who normally get, a crown on every tooth, and you're able to do either just a simple resin filling or an inlay and onlay and save them 3/4 of that tooth for, at this point I have 7 or 8 years success rate. It's incredible.
Yeah, that's awesome. Almost in the layman's terms, when I first came into the field, as it was put toward me, keep your stock parts as long as possible.
Exactly. And it's a very challenging. The insurance companies make that challenging, which obviously is not ethical. But you're dealing with a lot of people who, are taught, okay, this tooth is cracked, this tooth is missing 3/4, root canal, crown, and root canal post crown, where this is the complete opposite of that. Like, this tooth is missing 3/4. How can we maintain that other 1/4 of the tooth and keep the tooth healthy for as long as possible? It's great. It's really more widely accepted on the West Coast, in like University Pacific and USC, where Pascal Magnier and these big guys who kind of founded biomimetics, David Alamo, I had no exposure to it, and it's kind of eye-opening where if you're exposed to it at an early point in your career, you're able to, apply that throughout the duration of your career.
Yeah,
which is really nice.
This is the Dental Up Podcast.
Currently practicing from Kyle, Texas, please welcome Dr. Jose Alamo, DMD.Ficd. How's it going, Dr. Alamo?
Oh, just fine. Thank you for having me, Brandon.
Yeah, it's great to have you on the show. Thank you so much for taking the time out of your schedule. So I see down here that you had done some volunteer work in Nicaragua and Panama. Can you tell us a little bit about that?
Oh, yeah. This has been a very cool experience. I go with a group out of the Northeast. They're mostly from Boston and Rhode Island.
Mm-hmm.
It's a big group of providers, included our dentists, physicians, audiologists, optometrists, and physical therapists. And the last time we went, there was 80 volunteers.
Wow.
But we started off by going to Nicaragua. I jumped in about there maybe 12th, 13th trip, and they go every year. And I've been lucky to go with them most years. So we went to Nicaragua twice, and now been to Panama 5 times. The last time I went, in 2018, we were able to treat over 800 patients in the dental department alone.
Wow.
And it's been super cool. Yeah, we'll go to a remote part of the area. Most of the patients there wouldn't have access to a dentist otherwise. They would have to drive into Panama City, which can be quite far and expensive. Believe it or not, some of the dentistry costs the same in Panama City as it would perhaps in some parts of the United States. And so it will be unattainable. So we're able to do some good work. And now the group goes back yearly, and we can see the same patients sometimes and see how they're doing,
Oh, that's awesome.
do exams, and hopefully in the next few years we can start doing some more comprehensive work.
So do you go every year?
I haven't been able to, as I've been getting involved in things like the Hispanic Dental Association,
Mm-hmm.
and then in my startup. But I think I'll be going not in 2020 but 2021 again. I'm looking forward to it. I definitely miss being out there, and you definitely end up taking more than you give. I think it's a natural thing that happens, and I hope that as my career goes on, that I'm able to do more to do more social service work, like being able to be in a position where I can do dentistry potentially for free.
Yeah.
But that's kind of like a lifetime goal.
This is the Dental Up Podcast.
So, Dr. Bowman, how do you get patients to agree to move forward with treatment?
Well, the best way to do that is to hold off on presenting treatment. And what I mean by that is, I think that if you look at the way most dentists and dental school students are trained, they're trained to learn how to diagnose a condition or a problem, and then they're trained to determine the best solution for that, and then they're trained to learn how to do that. And the problem is, when we get into private practice, we talk to our patients the same way. We say, hey, John, you got a cracked tooth with an old silver filling in it, so you need a crown, and then this is how the crown's going to go for you. And then a lot of times they go through the process of explaining how a crown is done,
Yeah.
which is like the last thing you want to talk about. I've always said that if dentists were travel agents, no one would go on vacation, because we would always talk about like the process of going to the airport, standing in line, waiting for a delayed flight, and so on. We would never talk about what it's like to be at the destination. So what we need to do instead, and this is the thing that I teach in my communications course, is we need to understand how to recognize and present and describe the dental problems and conditions that our patients have in a very compelling way, so that they understand what's going on inside their mouths. And once they understand the problems and conditions that they have, once they thoroughly understand that, and that they're not going in the direction that they want their oral health to go, then they're going to be much more receptive to learning about the solutions to those problems. So, I've always said that no one wants dentistry. I alluded to that earlier. No one wants dental care. No one wants dental work. But what they do want is they want the problems that they know that they have to go away.
Yeah.
So when you can get really good at presenting problems and conditions to your patients, then your acceptance of treatment is going to go way up. And the way to do that is to spend a whole lot more time talking about the problems that you see, showing them good digital photographs of those problems, and then describing how those problems progress if they're not treated, so that patients begin to say, hey, what can you do about this? How can you fix this? Instead of spending all this time talking about the treatment that is for a problem that the patient may not realize that they have, because oftentimes we jump too quickly to the solution. So I call that leaving them behind at the problem. This is one of the major components of my communications course is showing team members and doctors how to recognize and describe problems and conditions in a compelling way.
This is the Dental Up Podcast.
So, Dr. Lau, going back to the previous subject, are there any marketing strategies you'd be willing to share with us?
Well, one is what I lecture about, and that is finding a particular group of patients that need you and can afford you and appreciate you. And of all the generations that are out there, if we move from the elderly all the way down to millennial, centennial, that generation that has by far the most susceptibility and the most success for a present and future dental practice is that segment of the baby boomers. They are the one that own most of the wealth in the United States, and they are the ones that actually have many of the significant dental conditions that we see, which ranges all the way from periodontal disease, in which 2 out of 3 baby boomers have bone loss, to dry mouth, and they are also the ones that are generally getting the implants. And now that we know that a good probably 20% of implants get implantitis and potentially are lost, this is an excellent group for us to focus with. So in marketing, in my mind, is find that niche of patients who need you, want you, and can also pay for you. And that would absolutely be those individuals born between 1946 and 1966. My other area that I begin to appreciate now more than ever is that dentists always tend to gravitate where there are also dentists, which in my mind, if I was managing any business, why would I do that?
Yeah.
So I think my point is that we always go to those areas where everyone else wants to go, and then we turn around and complain because we don't have enough patients. There are a substantial number of rural areas in the United States that are totally untapped, and if I was a young practitioner, that's the first place that I would be thinking about is going. Plus, that's where they're needed. So rural dentistry, in my mind, is still a wide open area for success. And that's what I would advise any young practitioner who's going to set up a practice, which, as you may know, that is few and far between because primarily of the student loan debt.
Yes.
But dentistry is still an incredibly viable, positive, successful profession. Just don't go to where everyone else wants to go, and I think you will be happy.
Yeah, creating that competition instead of, like you're saying, going out in those rural areas where people need it. I imagine you've come across quite a bit of that, seeing that you've spoken in 49 out of the 50 states.
But and actually, I just went to Idaho, so now I'm at 50-50.
Nice.
But it is, in creating marketing, you don't do what everyone else does. In other words, I'm always intrigued when someone wants to send out postcards with something like free whitening with your next dental visit, which means all I'm going to get is a bunch of millennials who want white teeth, who have no money, who generally are using their parents' credit card to pay for it, when there are so many outstanding procedures that one can do. But you've got to market it. You've got to use the right technology. You've got to have a website that introduces a niche. And for me, if you don't have minimally invasive dentistry on your website, then I believe that that you're going to be way behind the curve in moving forward.
Yeah, it's interesting you mentioned the website, because I still come across quite a few doctors that don't have them up, and it's kind of strange they don't have a web presence in this day and age. But and then
the other thing that's interesting to me is web presence. I'm on dentist websites every day, and they're almost cookie cutter.
Yeah,
they're almost like, here's who I am, come see me. And actually, your best websites are those which are compelling, which is why you should see me, drawing the patient in. And so I'm always interesting when I don't see any website that really have quality, real-time patient testimonials. You've got to have things that discriminate, that why you're different from anyone else. But I do want to backtrack a moment.
Mm-hmm.
We still believe that the number one way to get a high quality patient that you want, that is compliant and has allegiance to you, is by word of mouth. And that is relationship building. Like.
Yeah.
So when you find great baby boomers that demonstrate quality of care, it's what, I'm part of the Pankey Continuing Education Institute, and Dr. Pankey, which is a very viable institute in Key Biscayne, Florida. And Dr. Pankey always says, like. So you find that great patient, guess what? They're going to refer you another great patient.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.